Tasmania's anti-corruption watchdog has found misconduct by two high-profile hospital managers from New Zealand. The Integrity Commission found Jane Holden and Gavin Austin used their positions to unfairly employ family members. A highly anticipated report said the nepotism cost taxpayers more than $500,000. The report goes on to describe a culture of spin and cover-up in health. State political reporter Anna Fromberg begins our coverage.
The Integrity Commission's first high-profile report shocked Parliament.
Appallingly, the report reveals allegations of nepotism, undeclared conflicts of interest with no attempt at management, numerous breaches of process and failure to comply with procurement and employment policies and procedures.
Hospital managers Jane Holden and Gavin Austin are at the centre of the misconduct. They came to attention after a complaint by a King Island resident. The complainant was concerned building work at Curry Hospital had been given to Ms Holden's husband and Mr Austin's son. That led to a major investigation.
It was a complex investigation and it took significant resources from the Commission to complete it. It took approximately 12 months.
Jane Holden headed up health in the northwest before moving south. She and Mr Austin were part of a self-described health management dream team in New Zealand. The investigation found she gave consultancy work to Mr Austin in Tasmania, paying him $8,000 for 8 days' work. A month later, Ms Holden failed to declare a conflict of interest when she chaired a selection panel that gave Mr Austin his senior executive position in the state public service. He was offered very generous terms and conditions, including an accommodation allowance of almost $300 a week for over a year. Last year, Ms Holden also created a full-time position for her husband as a tradesman within the Southern Health Organisation.
Ms Holden's husband was given the opportunity to review the interview questions and model answers in advance of his interview. He was subsequently offered the position.
Gavin Austin went on to head Northwest Health and employed Ms Holden's husband, who was described as a contractor without a contract. He approved a $6,000 payment so the carpenter could return to New Zealand to obtain proper building accreditation. He also paid his public indemnity insurance and approved his accommodation bill for King Island.
This represented a total of $9,100, even though accommodation was provided free of charge at the nurses' quarters.
The report says Gavin Austin employed his wife in a series of jobs that weren't advertised. He also employed his son to do maintenance work. He gave consultancy work to numerous friends and associates from New Zealand. Some of them were later given jobs that weren't advertised.
The financial cost of the non-compliance identified during the investigation is estimated to exceed $500,000.
The investigators' 200-page report has been given to the Solicitor General.
Anna Fromberg joins us now. Anna, what's the fallout from the report?
Peter, at this stage, no criminal charges have been recommended. In relation to Jane Holden, as we know, she was removed from her position as the head of the Southern Health Organisation last Friday. She's reverted to a $300,000 a year position that no longer exists. The state government is now seeking to manage the misconduct highlighted by the Integrity Commission report through the State Service Act. So what that means for Ms Holden's future remains unclear.
Has the government taken any action against Gavin Austin?
Well, the Premier wrote to Mr Austin yesterday and advised him that he had until the close of business today to explain why he should keep his job. We understand that Mr Austin hasn't responded and hasn't given just cause for why he should not be suspended. The government is considering this matter overnight and is expected to make an announcement on this tomorrow. So again, it's wait and see.
State political reporter Anna Fromberg. The damning report has prompted the Health Minister to announce an overhaul of his department. Michael Ferguson's vowed to bring about culture change.
The investigation revealed a culture which turned a blind eye to breaches of policies and improper conduct. When it was questioned, the Integrity Commission found the reaction was a culture of spin and cover-up.
The culture is unfortunately has been for a long time a lot of cover-up, obstruction, and that's the way the department has been running.
Despite many people being aware of the allegations, the Commission said it took a member of the public to raise the alarm, revealing an unethical culture within the department.
I think it's very telling that it took a member of the public to blow the whistle and nobody who was actually working there.
It has sort of been swept under the carpet on many occasions, and I suppose it does show the culture of the health department.
I find it potentially alarming that they did not apparently did not make their concerns understood.
The government looks set to use the report to restructure the health system at a time when it needs to find huge savings.
We need to rebuild our health system from the ground up. We can't just keep sweeping around the edges or making piecemeal policy changes at the margins.
The Integrity Commission makes 11 recommendations to prevent misconduct across health and the entire state service. They involve declaring all conflicts of interest, a review of remuneration to public servants, and an audit of all recruitment in the North West health system.
We're looking forward to a new start and having some appropriate sort of governance back in place and accountability.
I think clearly it needs an overhaul. I think that has already started.
The events occurred while Labor and the Greens were in government. Both are being careful with their reactions.
These are serious allegations. You wouldn't expect me, I'm sure, to respond to that straight away.
All of us here have an obligation to work to ensure that public dollars are spent judiciously.
The Auditor-General has been asked to audit the remuneration within the North West Health Service and is already auditing recruitment practices across the state service. Ellen Coulter, ABC News.